Okay, so let's talk about breast lift scars or mastopexy scars. They really come in 3 different flavors because there are 3 different techniques to performing breast lifts. The least effective, or the one that doesn't create a whole lot of change, is the donut lift or periareolar lift. It's a great operation. I perform it all the time, but it cannot reliably move the nipples much more than 2 centimeters north, and it doesn't have a whole lot of power to tighten up a bunch of loose tissue. So the least scar burden, or the breast lift with the least amount of scarring, is the periareolar or donut lift. And this leaves a circular scar around the areola at the junction of the normal colored skin, that is the color of pretty much the rest of your body, along with the pigmented areola skin. So where the 2 skin types meet is where the incision is placed. And a lot of women have large areolas, and this reduces the size of the areola down to around 4 centimeters in diameter. So the final size of the areola is generally around 4.5 centimeters in diameter, and the excess areolar tissue or areolar skin beyond that is removed, and that is how the nipples are elevated and the skin is tightened. The next level of breast lift or mastopexy is the circumvertical or lollipop lift. This leaves a scar around the areola just like the periareolar lift, but it also adds a scar down the center of the lower pole of the breast. So it adds another scar to the meridian of the breast, say at about 6 o'clock off of the areola, and that vertical scar allows us to tighten up the soft tissue even more and move the nipple up even further. And if the distance from the future or new nipple position down to the bottom of the breast or the breast fold is really long, then you have vertical excess and you need a Weiss pattern mastopexy, which leaves the anchor-shaped scar. So with the anchor-shaped scar or Weiss pattern mastopexy, we have the ability to adjust all dimensions of the breast and get rid of extra skin from all dimensions of the breast. So I hope that makes sense. So the 3 levels of mastopexy are the donut lift or periareolar lift, followed by the circumvertical or lollipop lift, followed by the Weiss pattern or anchor-shaped lift, and which one you need depends on your breast measurements. One point I want to make is that over time, the vast majority of patients choose shape over scars. Meaning in the end, you are going to look a lot better and probably be a lot happier if you have a good, attractive breast shape with scars than having a less attractive breast shape without scars. So we always say shape is queen, and in general, over time, you're gonna be happier with scars having a good breast shape than having a not so great breast shape without scars. So I hope that helps make sense of the mastopexy or breast lift scars. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.